Hey guys, welcome back. Another episode of Tattoos and Telehealth. I'm Kelly White with Kari Health, and this is my great colleague and friend Nicole Baldwin. And we're going to chat for just a little bit about something that's kind of near and dear to us. But first, our lawyers and all the peeps in the background that we absolutely adore. Shout out to all of our people in the background that make this possible. Make us say that this podcast and this little conversation absolutely does not constitute a patient-provider relationship and that none of this is to be considered medical advice. We're just two gals chatting it up, having a conversation about some things that we see daily in our practice that we want to pass on to everyone else. So, having said all of that, we want to visit for just a little bit about your vials of medication that you have in your refrigerator. So, we prescribe a lot of compounded GLP-1 medication, which, as everyone right now knows, is tirzepatide and semaglutide mostly. There's some others, but those are the two that we see the most. And what we mean by your vial, it's the little glass bottle that you get or syringes that you get from the pharmacy when you see your provider and they prescribe your GLP-1 medication, whether it's for weight loss, for diabetes, whatever the situation may be. We want to chat with you about that expiration date. So there's a couple of things, right, Nicole? So there's a best use date and there is a vial expiration date. So what is the difference? Why does it matter? What do we need to know about that? Who cares? Like I mean, I assume it's not the same as you go buy a jug of milk and it's, best use date on the jug of milk. Does that mean that it's going to grow mold? Like, what do I need to know?
Yeah. So what is commonly in the medical world called the bud date is the beyond use date. And everything that comes from the grocery store and that comes from the pharmacy, just the same. The FDA says it's got to have an expiration date. It has to. And so everything has an expiration date regardless. Medications are no different, especially those in the vials. The importance of the vial is that the beyond use date or expiration date on that is how long it's good without being punctured. That's the big thing there. And once you puncture it, whether it's insulin, whether it's B12, whether it's GLP-1, I don't care what it is, once you puncture it, it is only good for 28 days, regardless of the bud date. If it says on there, used by or whatever, 10 years from now, once you puncture it, the clock starts ticking. Once it's
Now,
punctured, it is
does that mean
exposed.
does that mean they pop the top or they actually stick a needle in it?
Stick a needle in it.
Gotcha.
Once it's punctured, it is exposed to potential contamination from needles, syringes, the environment, and bacteria and other pathogens can grow inside the vial. And over time, that increases the risk for infections, especially when administered subcutaneously or intramuscularly, however you're injecting it. So some pharmacies will say, oh, well, we have a beyond use date of we have a beyond use date of 6 months. Okay, great. That's great. But if it's a multi-use vial, there should not be doses beyond 28 days because once you poke it, it's only good for 28 days. Otherwise, on day 29, you're really increasing your risk for infection, cellulitis, and things like that. Any medication, including insulin and biologics, can degrade once the vial is open. So you shouldn't even really flip the top. I mean, you have to puncture it, but, especially once you puncture it, but it can lose its effectiveness, which can compromise treatment outcomes. And you can go by the beyond use date if it has not been punctured. And I think patients think that they can just get a large dose of insulin or a large vial of B12 and they can use it till it's gone. And that really is, you really shouldn't do that. You really shouldn't do that. You really should pay attention to when you puncture it and then you put with a marker, opened on or good until 28 days. What are your thoughts on that, Cal?
So, I think that it's a really, I think it's a common thing for people not to understand the difference between the two. I think that whenever you see that beyond use date, it's very easy to think that it's as good as an expiration date. And it's as good as saying, well, it's going to be good until this, no matter what. And I think that's very misleading. I think that, pharmacies do the best that they can in certain situations, but I really wish that we could even see a, puncture date on the vials as well, or on the packaging. I think that would be beneficial for patients if we could see, a beyond use date. That's certainly helpful. So we know how long the vial itself is good. But even if, under that, if it could say puncture date, no, letting someone know puncture date 28 days, just as a reminder, always as a reminder, 28 days, puncture date 28 days on every vial that goes out. And my concern there is not only their risk for infection, but as you mentioned just a second ago, those medications start to degrade, meaning they break down. So they become less effective. So let's say we're giving insulin to our diabetics and we're asking them to dose this based on their blood glucose readings. And for some reason, they're dosing themselves, but their glucose never goes down and it's not responding appropriately. It continues to climb, continues to climb. They're dosing insulin, continues to climb. They're dosing more insulin. And one of two things can happen. They either go into what we call DKA, which is where they're just an extremely high glucose because their insulin was less effective. It had broken down. It was too old. It wasn't doing its job, which I have actually seen happen. Or heaven forbid, they run out of that insulin. They pop a brand new vial and go, okay, I'm gonna double it. It's not working. I'm gonna do 12 units this time. And they overdose on insulin. And now we're in the opposite problem because this is a fresh vial. It's brand new. It's ready to go. It's full potency. And they doubled it because they weren't seeing the effectiveness. And now we have the opposite problem. And they're hypoglycemic. And so we flip-flop the scenario,
Yeah.
which can be, detrimental. It can be very, very problematic. So I think it's very important that we talk about and make sure that everyone understands there's a puncture date on these vials for lots of reasons, not just the risk of cellulitis, but just the risk of that medication not being effective and what that can do to dosing. I think that can be detrimental. And that goes for all medications, right? So, I've seen testosterone come in those medications. Sometimes men and women will get their own testosterone vials and keep that. And that's an intramuscular injection.
That's
Have you ever
deep.
seen an abscess of a muscle? Ooh, it's not pretty.
That's
It's not
painful.
pretty. It's painful. So if you get an infection that abscesses itself off in your muscle, oh, friends. So I mean, there's a lot of medications that we, puncture, use the medication, keep in our refrigerator, um, that may or may not be, good past that certain time.
Yeah, there's even if you, I think it's on like a bottle of ketchup, you can store it at room temperature for a long time, but you also see use within 7 days of opening or whatever it is. It's longer than that, but I'm just saying there's so many things in your refrigerator that say use within 7 days of opening or use within 28 days of opening or whatever. Like even a bottle of soda, it can sit at room temperature probably forever. I mean, I don't know. I'm sure there's a date on it, but once you open it, it goes flat eventually. It's not good. It's even if you open it and then you put the lid on it, it's sitting out, it will still go flat once you open it. But the expiration date is, 10 years from now, right? But once you mess with it, it starts to degrade. The same concept with medications that you're injecting. So you don't just have, you drink a flat soda and whatever, you're injecting this in here, you're injecting it into your body. And so you really have to be careful with that. And that's a lot of the reason why there's not large vials of things, that we can't just send you a large vial and say, have at it. I remember working at the hospital, and if we opened a multi-use insulin, we had to write with a marker 20, the 28-day mark. So
Yep.
I mean, it's just what's safest, and you don't want to risk infection and injecting things, and so
Well, that brings up the next thing. Some of these medications, I do a lot of IV therapy for archery when we go to archery tournaments. And so I do a lot of IV therapy at those archery tournaments. And some vials are preservative free, meaning they have a lower shelf life and a lower best use date. And then those with preservatives may have a longer shelf life or best use date. So those things matter, the whether or not what you're getting has preservatives or doesn't have preservatives. And so, you know, guys, what I think what we're getting to here is ask the questions. Ask the questions about what you're getting. Does it have preservatives? What is the best use date? What is the, what can you expect after you open it? What can you expect after you puncture it? All of those questions are very, very important. But then as providers, our job is to spend that time educating our patients. Once you puncture that vial, you've got 28 days, period, end of story, 28 days. And then as your provider, our job is to be sure that you have another vial coming before that 28 days. If this is a continuous regimen, if we have you on insulin for your diabetes, we want to be sure you don't run out. So our job is to make sure that after, before that 28 days runs up, that you've got another vial, whether the one you have is empty or not, because that one's done.
Yep, absolutely, absolutely. And the bud date, the beyond use date is, think of the expiration date. But just like anything else, once you open it, once you puncture it, the clock starts ticking. It's that to where it's just not good anymore. And you know, I get a lot of patients that want more than 1 month, and I'm like, okay, but I have to send you multiple vials,
Yeah.
right? So if you want multiple months, you've got to have let's say you want 3 months, you got to have 3 vials. And the one you open and then you use it, and then the one you open and then you use it, and then the third one you open and then you use it. And that's why it comes that way. And that's why we don't just prescribe haphazardly these large doses, because why get something and be wasteful if you can't safely use it after 28 days? We don't want you using it. It's a safety thing. It's not that we're being rotten or trying to be difficult. It is what it is. So
Yeah, for sure.
yeah.
Yeah,
So I think we drove our point home today.
for sure.
Just please understand why we dose things, why providers dose things the way that we dose things. There's always your safety in mind. We shouldn't send you a larger volume because it's just as cheap or whatever. It has to do with that beyond use date, and then the puncture date also is the most important. So pay attention, ask your questions. If you want to talk further about this, you can reach me at www.hamiltontelehealth.com. And for Kelly, you can reach her at,
ChariHealth.com, CHARI health.com.
all right, if you guys have any questions, let us know. We'll be happy to explain things further. If you have any questions or just need some medical care online, we can certainly help you. Have a good day.
Hi, guys.